One of the big problems right now is hospitals. They're filling up, and it's a combination of a lack of staff and more people seeking care, specifically emergency rooms. We have the Seneca County Health Commissioner with us today, Ann Goon. So, Ann, what does COVID look like right now in Seneca County?
So we have an increasing demand for test kits, rapid test kits. A lot of people going to the ER and other places seeking tests.
What's the
It's
big
spreading
problem?
quickly.
What's the big problem when it comes to emergency rooms? What does that look like when people are going there to get a test or get care?
Sure. So if a person isn't really sick enough to need emergency level care, they're actually preventing other people who need emergency care from getting that care. So it's bogging down the system. So people who don't have symptoms or who have mild symptoms need to go somewhere else besides the emergency department to get tested.
What's the hospital situation in Seneca County when it comes to the staffing, the number of ICU beds that are filling up? Are you seeing those serious COVID cases increase?
Yes, we definitely are. We are seeing both with total inpatients and specifically in the ICU that COVID is making up a significant portion of those patients. Changes from day to day, but especially in the ICU, they are accounting for 50% or more of the patients in the unit, and they are the ones. Nearly everybody that's on a ventilator is a COVID patient.
Okay, now you've said before in months past when we've had a chance to talk that the vaccination rate wasn't quite where you wanted it to be. That combination of that plus back to school, what's your prediction here over the next few weeks?
We certainly have not hit our peak yet for this surge here in Seneca County. We're maybe a week out from that, but we're seeing a really rapid increase from December 27th on. And so, unfortunately, it's going to get worse here before it starts to get better.
And what do you think one of the biggest hurdles is? You mentioned a lack of testing and availability for people to do that, especially with rapid tests. ERs filling up. Are there any other challenges that you think you might be able to work around if you had the public's help?
Well, certainly just taking every effort to prevent the spread in the first place. So, wearing a mask. I mean, if there's any time to wear a mask, now is the time to do it. When you're indoors, anywhere where you're not with just your own family, wear a mask. And usually the more layers, the better. So right now, a surgical mask and a cloth mask together is better than a cloth mask by itself. An N95 is better than a cloth mask as well, clearly. And not gathering, not avoiding those large gatherings of people will also help, because the fewer people you're around, the fewer people you can potentially spread it to if you develop it, and you're less likely to get it as well. I mean, you can choose not to wear a mask. That also means you're choosing to potentially be exposed. It makes more sense to view this as a time when you need to take universal precautions. You need to assume everybody potentially could have COVID-19. This Omicron variant spreads very, very easily. And so take that assumption and take action accordingly.
All right, well, Ann, thanks so much for being with us today. Ann Goon is with the Seneca County Health Department and, of course, sharing what is happening in that area.
Thank you.